Okay, yep. So hi everyone. Thank you so much for signing up for our session today. So today we have Dr. Patricia Bastick. She's a medical oncologist and she has a special interest in the treatment of patients with breast and genitourinary cancers, including testis, prostate, bladder, and kidney cancers. So she's heavily involved in clinical trials, having worked as an investigator for over 60 international phase 1, 2, and phase 3 trials over the past 15 years. She's currently the supervisor of advanced training in medical oncology and has always been involved in training and education of junior doctors. She is the deputy chair of Germ Cell Subcommittee for ANZUP. So over to you, Dr. Bastick.
Beautiful. So, Sophie, you just want me to give me a little bit of an introduction, you mean? Are you putting questions to me, or are you?
Oh, so you just you just have to introduce about yourself and like what you've done in the past 10 or 20 years for your career and what medical legal cases that you have been doing or
Yep, no problem. So thanks for the invitation for today. So as Sophia kind of introduced, I work at St George and Sutherland Hospital in the southeast area of Sydney. Been there for just on 20 years. I did all my medical training in Tasmania and still do a little bit of locuming back there when I kind of go and see family. So in the last 10, 20 years, really working primarily in clinical medical oncology, so treating a lot of breast, prostate, bladder cancers. But as you mentioned, a lot of clinical trials. Hoping to kind of transition as kids finish school to work a little bit more between Sydney and Tasmania if I can. So we spent about like one long weekend, a month down there and do a bit of locuming at the cancer centre down there. And on the side, I've been involved on the board of one of our cancer centres, so Cancer Care Associates, which kind of help setting up and operating a number of private cancer centres around mainly New South Wales, but also expanding into Queensland next year. So looking on transitioning a little bit less into full-time clinical work and some extra, medically related duties, which is where the kind of medical legal has come in. I mean, probably about the last 5 years, I've done reasonably ad hoc kind of cases that have come to me either through private solicitors or through a UK-based company called TMLEP, which I'm guessing some people have probably heard of. And they've been mainly medical negligence cases, I believe. So when I was asked if I would do medical negligence, I think they're the only cases I've actually ever done. And they're nearly always cases about delayed diagnosis or a misdiagnosis. A lot of them being breast cancer related, but others might be screening PSA levels for prostate cancer that had been missed. And my role in those is usually to comment on the significance of the delay. So how has that impacted on the treatment, the prognosis, and the likely outcome of patients? And obviously, sometimes I don't even know if it's for the defence or the plaintiff. So I just asked to kind of comment from a clinical perspective on what that delay has been the majority of the cases that I've done.
Yep, so we have 2 people joined us. So just want to ask if anyone has any specific questions for Dr. Bastick or if you have anything that you want to raise, please unmute yourself. Okay. So I guess it was like a very quick introduction, but very thorough introduction. So do you have any highlighted case that maybe you could tell us about? Like any medical negligence case that would like come to mind when it's like when people ask you about medical legal assessments that.
Yes, I guess the largest case was one actually just a few months ago, and it was a very young man who was diagnosed with testicular cancer when he was about 18 or 19, I believe. I went through chemotherapy at the time, and most testicular cancers are cured, so he was kind of thought to be cured at that point. And over the next 5 years, there's a very mandated follow-up schedule that's kind of written by the group I'm involved in, the ANZUP, which is Australia and New Zealand Urology and Prostate Cancer Trials Group. So we wrote a schedule of assessments that says they have to have their bloods and their scans done at various times over the next 5 years. And it sounds like with this case, the patient did do those things, but for whatever reason, a couple of the blood tests were missed. So even though he attended the appointments, no one kind of acknowledged that his tumour markers had started to rise. And normally, if that's the case, we would pick up the recurrence of the cancer very early so that we could jump in with either further chemotherapy or something that would cure somebody. But his was missed for approximately 6 to 12 months, to the point he actually ended up coming in through emergency very unwell, where his cancer had progressed significantly. And the impact of that delay was that he needed more chemotherapy than he probably would have had, but he also had a number of surgeries that were needed to remove residual tumours. And if his cancer had been detected 12 months earlier, he may have still had chemo, but he wouldn't have had all those complications of needing the surgeries and the long-term impact on his life. So given he was only 25, and that kind of really impacted his ability to work and his quality of life, and has a lot of complications from that going forward, I was asked to kind of comment on the significance that delay would have had on him and his long-term outcome and prognosis.
Yep, thank you so much for that. We actually have a new person who joined us, so just want to see if that person has any particular question for Dr. Bastick today. Or this will be recorded and definitely published on our YouTube channel, so everyone could have a look again at this one. But yeah, I guess that is all for today. If anyone doesn't have any question, or if you do, then please unmute yourself, or you can pop your questions in the chat box if you do. Yeah. If not, yeah, so thank you so much, Dr. Bastick, for today's session. And yeah, thank you everyone for joining, and I will end my recording now.